Hi everyone, welcome back. It's February 2019. My name is Dr. Sandra Ryerson. I'm a doctor of audiology living in Carroll, Iowa. And today's hot topic, it's a topic that everyone has a question on, earwax. What to do about it, what not to do about it. You may have even heard the phrase, never stick something smaller than your elbow in your ear. And you thought, now really, is that truly good advice? Well, you're about to find out. Earwax is also known as cerumen, and earwax, one of the main functions of earwax is actually to keep our ears clean. So many times people think their ears are dirty if there's earwax in the ears. That's not necessarily true. Earwax has a very good way of keeping our ears clean. It collects the dirt and debris that would normally just collect in our ears. It sticks to the earwax, and then the earwax will actually self-clean the ears on its own when left undisturbed. Earwax is also offers a protective mechanism. If a bug or something were to try and crawl into our ear, earwax creates an environment that is hostile to that kind of intruder, so you don't have bugs living in your ears. Thirdly, earwax does act as an emollient, and by having a little bit of wax along the linings of our ear canals, we actually find that our ears itch less, and it does protect our ear skin health, and so having a slight amount of earwax is in fact a healthy thing to have. I mentioned just a moment earlier that oftentimes ears self-clean, but sometimes for a variety of reasons it doesn't happen that way. And so when ears don't self-clean like they should, you'll start to experience a buildup of wax, eventually leading to the point that the ear becomes completely blocked, or as we often say, occluded. So when a person's ear is totally blocked with wax, they'll experience one-sided hearing loss. They'll experience oftentimes tinnitus or noise in the ears, or in just one ear perhaps. They might have pain. They might have drainage from the ear. They may have serious itching in that ear. One of the main reasons that people's ears don't self-clean like they should is because they wear hearing aids. So let me explain what that means. During the day, as we talk and chew our food and move our jaw for a variety of reasons, the ear canal is also moving, and that allows the wax to slowly work its way out of the ear, and it flakes out on its own. It flakes out as we shower. However, when you wear a hearing aid in your ear, you're preventing that process from happening. A lot of people have said to me in the past, "Oh, I never made earwax until I wore hearing aids." Well, that's not the case. They always made earwax. That's a natural bodily function, but because the hearing aid was in the ear, it started collecting more than it would otherwise. Now, back to that old adage, don't stick anything smaller than your elbow in your ear. Well, it's the truth. You should never stick things in your ear canal, other than if you've been prescribed a hearing aid by a licensed hearing aid specialist or audiologist. If that's not the case, don't stick anything in your ear. Don't be sticking Q-tips in your ears. Q-tips, bobby pins, safety pins, keys, toothpicks. I've heard of so many different things people have tried to use to clean their ears. Now, what happens when you do this is you could lacerate or cut the ear canal wall, which can create a serious infection. Also, you could go too far, and you could pierce your eardrum, and you could even disrupt the middle ear bones and cause dizziness and permanent hearing loss. So it's very, very dangerous sticking things in your ear. Now, best case scenario, sticking a Q-tip in your ear over time, what could happen? The main thing that could happen is you're pushing earwax in whenever you use a Q-tip. So you may feel like you're getting something out on that Q-tip, but you're pushing more in than you're getting out in the ears. So that's best case scenario, that eventually you're going to push enough dead skin and earwax in your ear that you're going to create a callus on the eardrum, or just a severe blockage of the eardrum that's going to require intervention by an ear, nose, and throat specialist perhaps. So that is why we say don't stick anything smaller than your elbow in your ear. Another one, don't use ear candling. Ear candling is not a safe product to use. It's not a safe procedure to do. There is zero clinical evidence that ear candling works. What comes out during the ear candling process is not earwax. It is not. It is a byproduct of the burning process. So please do not ear candle. So now what to do? What to do to clean your ears? Well, the first thing you should do is just remember that your ears do clean themselves. So generally, most of us can just take a washcloth and just wipe our ear out, or just the bowl of our ear out every so often, and that should do it for most of us. However, if you wear hearing aids or your ears just don't self-clean like they should, you may have to take some proactive steps. Now, before I give you any tips, please consult your audiologist or your primary care physician or primary care healthcare provider before you do anything to clean your ears, but I'll give you some tips of what I recommend for my patients. Take an eyedropper and fill it up with some 3% hydrogen peroxide, just a typical hydrogen peroxide you can find at any drugstore. And tilt your head to the side, put the eyedropper in your ear, and release enough hydrogen peroxide out of the eyedropper to fill up the majority of your ear canal. Let it sit in there for a while. You're going to hear it fizz and bubble. You're going to hear and feel that in there. Let it sit in there for a while, maybe 30 seconds. Then take a cotton ball or a washcloth or something and tilt your head back up and let it drain out and let it dry out that way. So these are some tips for you to help you clean your ears well. If you have any questions, comment on this video. Comment, let me know what your questions are. I'm happy to answer those for you. I hope this gives you some tools to use, some ideas of what is healthy to do and what isn't healthy to do. And again, like I always say, please share this and if you can, subscribe to my YouTube channel. Tell people about it. It really helps get the word out, and I appreciate it so much. And have a great February, and I'll see you next month.